Hello, everyone. Welcome to this live Parent Tune workshop. I'm Neha Nimisha and I'm looking forward to hosting this workshop with Dr. Suresh Gowda, consultant pediatrician and neonatologist at Motherhood Hospital, Bangalore. Meningitis is a serious infection that affects the protective layer around the brain and spinal cord. Meningococcal meningitis is caused by the Neisseria meningitidis bacteria. It can be transmitted from person to person through respiratory droplets. Patients are known to have rapidly progressed to death, often within 24 to 48 hours after the onset of symptoms. One in five may experience lifelong complications such as hearing loss, brain damage, mental disabilities, or loss of limbs. Meningococcal disease is observed in children under 5 years of age, immunocompromised individuals, adolescents, and young adults. There have been major improvements in prevention of the disease. One such measure is preventive vaccination that can save lives and reduce complications. In addition, good hygiene and social distancing of kids from the infected individual is also essential for the prevention. So, doctor, to start with, I would request you to please help us understand more about in what ways can the meningococcal meningitis vaccine strengthen a baby's immune system?
Hi, good afternoon, everybody. Firstly, I would like to thank at the outset the Sanofi team for giving an opportunity in education with regard to meningococcal vaccine. I am Dr. Suresh Gowda, a consultant neonatologist and pediatrician at Motherhood Hospital in Bangalore. Uh, as we all know that meningococcal disease itself, it's a very dreadful disease, the very word itself, because most of these tends to happen where the child could present with symptoms of fever and along with other respiratory infections with cough, cold, headache. And sometimes these symptoms, usually they could be the very first 5 to 7 days of life, they could be presenting with just non-specific symptoms which are not pretty serious. But however, the incubation period, that means from the time of onset to the severity of the disease, it's around uh, it could be anywhere between 3 to 10 days of life. But once they have it, the disease extends, rapidly tends to multiply, and that is where the problem starts with involvement of multiple organs for a baby. Now, coming to this vaccine part as well, in the West, this is part of the national immunization program, especially right from the age 6 weeks, 10 weeks, and 14 weeks, they would take that vaccine as well. But where, as in the IAP Indian sector, it is anywhere between 9 months onwards for a period of two doses, and then one at the age of 2 years if they're not been vaccinated with the previous two doses. The vaccine, the very word vaccine itself, what it tends to do is basically you're administrating these germs into the body's immune system, into the body. So once the body gets in contact with these germs, it will develop antibodies to fight against these infection. So in this way, meningococcal disease, because most of the times, majority of us are the carriers where these bugs tend to be within our respiratory tract, like the nose, where they're just sitting. But sometimes if the immune system is very low, these could invade where they could enter into the bloodstream, causing septicemia, that is, infection within the bloodstream, and they could involve multiple organs as well, especially the kidneys. But there are long term problems as well, where they could have seizures, neurological damage, and they could have hearing loss, and almost one in five could have some neurological deficits as well. But if you take the overall statistics, around 15 around 15 people, 15 out of 100, the death mortality rate is pretty high, even though they're quite treated with antibiotics as well, especially when they catch diseases. So this vaccine itself is more of a preventive vaccine in acquiring this dreadful disease. No matter if even if you come across, your body tends to fight against this uh, mm, meningitis. Your body tends to develop antibodies to fight against this infection, which tends to help in the long run.
So, doctor, What are the symptoms of meningococcal meningitis, and how can parents keep their children safe and secure from this disease?
Uh, the signs and symptoms is that it varies with the age group as well. For example, you could have a newborn baby as well, where they could be presenting only with fever, they could be presenting with lethargy and not taking adequate amount of feeds, or it could have a uh, baby who's just around 6 months or onwards, or a 1 year old toddler or anything, or a 2 year old or a 3 year old, where they could present with fever, they could complain of headaches, they could complain of sensitivity to the lights as well, where they're not able to open up their eyes to any flash of lights, headache, then they could have chills as well. And then they could produce with neck stiffness as well, where they're not able to move their neck backwards or completely extend itself. They could have severe neck pain and stiffness, and they could have these sort of a double vision, blurring of vision as well, headaches, fever, and these could present. Now, they could present with the symptoms of fever along with cold and sinusitis like illness as well. That's another issue. Now, the best, and this tends to happen especially in children who are less than 1 year of old, or there is an incidence where there's certain illnesses could be caught between 16 to 80, 16 to 19 years of age, and then above 65 years of age. Because if you say all this into consideration, this tends to happen in places where they're crowded, where there's plenty of people living within one locality, and they could go spreading in droplet like infection from one person to another. So the best way to prevent infection is not to utilize stuff used by other people who have this illness. That is one. Not to be completely in a crowded place as well, and especially when when you come across a baby or a child or a toddler or a child with these symptoms of fever and anything, it is better to seek medical attention. And at the same time, you need to follow up with your vaccination schedule, and you need to be updated in with your vaccination schedule as well for the same.
Clearly, vaccination is very important when it comes
Important.
to children's
Yeah.
healthcare. So, please help us understand, why are children at a high risk of meningococcal meningitis infection?
As I said, because the children, the mode of transport is majority of the times it could be droplet infection from the respiratory infections, and these common pathogens are living within our nasal tract, within our respiratory tract as well. Now, if you see the age group where the immune system is low, you could especially those who are children less than 1 year of age group, their immune system is very low. And at the same time, you could see the elderly population more than 65 years of age group, their immune system is low as well. Now, because of these droplet infection, which tends to spread from one person to another, or especially if they're in crowded places, these children, because of their low immune system, they if they catch this infection, they can deteriorate rapidly, and it's quite dreadful as well because it could just take in hours as well, and they could succumb. So because one is the immune system which plays a role, and the second is they are more prone for infections at this particular age group as well. And then you could have some high risk individuals who are having other medical conditions as well associated with this, who are more prone for meningococcal meningitis infections as well. That is why this age group is very important to be vaccinated.
As important it is to be vaccinated for these children, we have a question coming from a parent named Suman Tiwari, who is asking, "Hello, doctor. Could you please tell me more about meningococcal vaccination?" What would you want to help Suman Tiwari with?
Yeah, the meningococcal vaccine, there are three different types of vaccine as well. So this meningococcal vaccine, there are different strains. There are almost 13 to 14 strains of meningococcal, out of which around five strains are very important. That is A, C, W, and Y. But you have the meningococcal B as well. You have this component A, C, W, and Y in one of the vaccines, and you have a separate one which is the meningococcal the B vaccine as well. But the third category is you have a combination of all the five. With your Indian segment, based on the population and the geographic area, this ACWY strain is very, very, very important. And this vaccine is given with two doses with around 10 months and then 12 months. You get two doses of that. If you are not you had that dose, you can have another dose, especially at when the child is around 2 years of age. But having said that, especially and the next peak of onset is somewhere between the adolescent age group as well, where they can have another dose, especially if they're more than 15 or 16 years of age. That is one aspect as well. So this vaccine, meningococcal vaccine, two doses of injection could make a difference to the life in the long run. I would suggest you should go for the vaccine because this tends to fight against these bugs, and these bugs are within our natural common commensal within our respiratory tract, and especially when these invade the young babies or the children, they tend to get this infection and they could deteriorate rapidly as well. So vaccine is very important for this age group.
Definitely. So we have this another question from Mamta Rawat who is asking, "Hello doctor, I have two kids, 5 years old and a newborn. Are there any different signs of diseases in newborns versus the older child? Or how fast can it be contagious versus the risk rate?"
Right. Now, as I said, the newborns again, here in the Indian segment, we have just only the H influenza and the pneumococcal vaccine and everything. Now, particularly, we don't tend to vaccinate the at 6 weeks, 10 weeks, or 14 weeks in the Indian scenario, but in the West. But obviously, any newborn, especially within the first 3 months of age, the only way they could present is most of the time it's fever, and they could be very lethargic. They could be, they would not be able to take in feeds as well. And the best way to go with this newborns is what we do a clinical examination of the baby as well. And at the same time, we need to find out whether they're having any other associated symptoms. And at the same time, doing a blood test. And then we do a test called lumbar puncture as well, where a needle is inserted in the uh, back between the spaces of the bones, and the fluid has been collected because you have the brain and then you have the spinal cord which is connected from the end of the brain. uh, this is where you have the fluid surrounding it as well, which is called a cerebrospinal fluid, and this is tested through this fluid. So if a baby newborn who develops fever or anything, we would need to investigate it further. But not all every baby. See, we need to see take in other factors for the blood parameters, the clinical picture of the baby, and the investigations, and then go accordingly. Now, having said that, you have another 5-year-old. What you said, a 5-year-old literally tell about the symptoms. For example, a 5-year-old could present with fever. Then he could come in. He could tell you that he's got severe headache. Then he could say that he's finding it very hard in looking at bright lights, or he could complain about, says he could state that he's got pain in the neck and he's finding it difficult to move his neck. That is where or it could be that he's feeling a bit more drowsy, and that's where the 5-year-old could mention. This is how you could differentiate between the a newborn as well as a 5-year-old. This is mainly from the symptoms point of view. What we as clinicians, we would explain it to you as well if a situation arises, what tests you want to do further and how to go forward as well. Because not all fevers are meningitis. But at the same time, when you are treating any fever, we need to have that in the back of our mind, because if you miss this, then it's a detrimental for the baby and the family.
Another question we have from another parent named Vaishnavi who is asking, "Hello doctor, my friend's daughter is 7 months old and she has heard about this brain fever. She wishes to know, is it harmful, or does this fever have long-term implications on child's health?"
Yes. See, this usually these children with brain fever, they usually present with the fever, then they could have headaches, and They could have seizures as well. But obviously, seizures is when when a child or somebody starts fitting, there's a lack of oxygen to the brain. And when there's a lack of oxygen to the brain is like a powerhouse for the whole body as well. With the lack of oxygen to the brain, what tends to happen is then you could end up with neurological deficits. It's like some of them then could have an hearing loss, or some of these kids could have speech impairment, or they could have neurological deficits in terms they could have weakness on one side or in difficulty in mobility as well. In terms of long term, yes, they could have impaired neurological damage like hearing impairment, as well as neurological impairment in terms of their mobility and carrying out day-to-day activities. And sometimes during this dreadful disease as well, if the infection is quite severe, as I told you, that it tends to rapid fast, and at the same time, it could involve many other multiple organs as well. For example, in one of the meningitis, what tends to happen is the infection is so severe that you could have your fingers, the toes, and all the peripheries organs, the fingers and toes completely knocked off, and there are instances where they needed amputation as well, because what it tends to do is all the blood vessels get malformed at that particular point.
So, doctor, we have learned about this meningococcal meningitis vaccine and also about brain, uh, how does this work? How will this help children? So, please help us understand. Meningococcal meningitis vaccination is said to be vital for a baby who is 9 months old. So, what is the reason behind this?
It's vital because most of the times is sometimes what happens is you could have some of the immune system, the immune system itself who plays a role where there where antibodies tend to wane off during that particular age in most of these cases, and they would need to be vaccinated in order to develop antibodies to fight against the infection. For example, if you take something called MMR, we tend to vaccinate only at the age of 9 months, because you sometimes you have this mother's antibodies as well within them to fight against this infection. So here the 9 months is a dreaded period where uh, they could have their immune system and waning off as well, antibodies waning off as well to fight against these. And at the same time, they're more prone for infections in terms of simple cold, cough, or anything, and they could be they could act as a carriers in terms of transmission as well. And this is the age group where they're very, very vulnerable within the first 1 year of age group, even though they can to catch it and they deteriorate very rapidly. And this is very, very important. And the crucial is like they fix this like 2 doses within 1 year of age group in terms of 9 months and then at 1 year of age.
So, how can the effectiveness of the meningococcal meningitis vaccination be measured against seizures, which also happens to be one of the symptoms of brain fever?
Right. So when there is brain fever as well. As I said, they could present with fever, they could present with headache, and they could present with seizures. But the long-term implications, as I said, it could be hearing loss or it could be neurological damage, which could be impairment. And but the only way this could be measured is because this meningococcal vaccine, what it tends to do is it tends to prevent. It's not that all vaccines tend to prevent the disease completely. The symptoms are quite pretty less as well. Even though you tend to occur this particular disease, the symptoms could be less. And at the same time, even though the brain fever, which tends to have seizures as well, so this could completely help where the symptoms and the signs and the severity is very, very less in comparison for those who are not vaccinated.
We have a question coming from another parent named Mohini. She's asking, "Hello, doctor. My children were born in Australia. They are 5 and 3 years of old, respectively. They have got all the vaccinations mandatory for them there, but now I'm staying in India for past 5 months with my mother and sister and my two children. Their vaccination chart is also not with me. I'm not sure whether they have got meningococcal meningitis vaccine already or not. So should I get them vaccinated here? And what if they are already vaccinated for the same? Will it cause any harm to them? Please suggest.
Right. And if we go by the national vaccination schedule, as I said, in the West, it's part of the national vaccination program, where it's a national immunization program that all kids gets vaccinated, whether it's in the European sector or in the Australian sector or in the US as well. Now, considering that, I gather that you moved from Australia to here, and I assume that they are vaccinated because you regularly follow up with your general practitioner over there, or you get reminders being sent with regard to the timing for vaccination. But however, in the segment over here in India, there is it is being announced in the national vaccination schedule, but it is not given at a free of cost in the government sector, and it's more in the private sector which is available as well. I would suggest if you have been vaccinated there in the Australian segment, then there is no need to get another vaccination. But however, if the child or any individual has any other associated conditions in terms of which compromises their immune system, then there is no harm in getting vaccinated once again. That should not affect the child in any way.
Now we have another question coming from Rashid Sheikh, who is asking, can there be any long-term effects of brain fever like this even if my child recovers from it? So he says that my baby had got high brain fever a month ago. So how to know if it was meningitis?
Right. When you say high brain fever a month ago, because most of the times what we tend to do is when we assess, first is a clinical examination when you take them to a doctor, where you do an assessment with regard to what the cause for the fever could be. It could be simple cold, cough, or simple sore throat, could be urinary tract infection, which can be pneumonia as well. But you need to take the clinical picture into consideration along with the other vital parameters, and then you start the medications for that particular age group. But having said, sometimes when you don't find a focus to where the infection has started, for example, if the urinary test is normal, if there is throat examination, clinical examination is normal, then we would like to do something called a lumbar puncture. Like as I had mentioned earlier, that we have the brain, we have the spinal cord, which is all being surrounded by a fluid called cerebrospinal fluid. And the word meningitis is that is the it causes infection of the meninges, the membranes covering the brain. So this is where what we tend to do is we put a needle at the back between the two bone spaces and take few ml of fluid to examine this under the microscopy, and that is a clear indicator which will let us know that whether the child has meningitis or not. But having said that, you don't tend to wait to do all those tests and then start a treatment. We would probably start the treatment in terms of suspected meningococcal case or suspected meningitis case, and then we would do this test. And because the only reason is we need to find out the this will have the test the fluid from the back which is being tested, that will give us an indication for how long we need to treat, because there are certain conditions where we need to treat them with antibiotics for 7 days, certain times when we need to treat them for 14 days, especially if the blood cultures are positive as well, and certain times it goes for 21 days. So you would not need leave them half treated as well. Coming to your second question, to know that whether they'll have any long-term implications or not, any proven cause of meningococcal disease should be clearly followed up. One is you need to ensure that their hearing is not impaired following post them having that meningitis infection and are being treated. They need to get a hearing test done. Number one. Second things, they should be followed up for from the neurological point of view for a period of at least 2 years with the pediatrician in terms to see their gross development. It could be speech, it could be hearing, it could be their gross motor skills in terms of walking, sitting, and running, and overall. So the development needs to be assessed as well to see if there's any deficits post infection.
So another question is coming from Sana Mudassir, हु इज आस्किंग डॉक्टर मैं बिहार से हूँ वहाँ ये वैक्सीन क्या सरकारी अस्पताल में उपलब्ध होगी या फिर मुझे प्राइवेट हॉस्पिटल में जाकर लगवाना होगा? कितनी बार लगवाना होगा 9 मंथ्स के बच्चे को ये वैक्सीन? What would you suggest?
Right. Unfortunately, we are in a segment where the budget is very, very less in terms for education and health budget in India is very, very less from the government side. So this is not available in the government sector. You'll have to get it in the private sector. Like as I mentioned before, 1 year you could have two doses of this vaccine as well. Or else, if this baby is not vaccinated within the first 1 year of life, then you could have a single shot at the age of 2 years as well. And this is only available in the private sector. And as far as I know, I don't think there's any state which is offering meningococcal vaccine in the government sector.
Doctor, when it comes to vaccination of meningococcal meningitis vaccination, there are a lot of questions which parents have. So I want you to please help us understand better that if a child is undergoing a severe headache after the meningococcal meningitis vaccination, so what should parents do?
First, we need to ensure that every vaccine could have mild effects as well, or a severe anaphylactic reaction as well. We need to take the history, especially when they come to the clinic, and they should provide us whether this child has had any other illnesses in the background as well. At the same time, when the anaphylactic reaction has occurred in the past as well. Simple vaccinations where they tend to get mild pain at the injection site, swelling at the injection site, or there could be an element of fever as well. Now, coming to your question, post vaccination headache, I would suggest in certain cases, it is better to consult the doctor once again as well. Make sure the child is uh, well hydrated. Make sure his intake is pretty good. The second aspect is paracetamol can be given every 4 hourly to 6 hourly over a period of 48 hours as well. And thirdly, if the symptoms tends to persist more than 36 to 48 hours, they need to seek medical opinion.
Now there's a parent named Madhumita who is asking, hello sir, I'm going to shift to Canada in next 10 days. My baby is 7.5 months old as of now. Can I get this vaccine administered now itself as it won't be possible for me after that? Also, if it's not possible here, will the same vaccine be available there as chance of the same disease being prevalent there are very low? Please guide me. Dr. May, that's it. That's what she wishes to know.
Yes, I mean the vaccine it's available there as well in Canada. If you wish to get it there in Canada, you can get it as well. But as per our vaccination schedule, it is from 9 months and two doses within the 13 within the first year of life, or else another dose at the age of 2 years as well. And it should be available in Canada where you can get it as well. Now, whether you should want to get it done 7.5 months of age, it should not be a problem as such to vaccinate at this age because you have this. If you see the 6 weeks, 10 weeks, and 14 weeks, where there is meningococcal vaccine being given in the western side as well, that is included as part of the national vaccination schedule. But again, that depends on the strains as well.
So, doctor, as we just discussed that how vital could it be the vaccination for a 9 months old? So, we have another question coming from Ani, who is asking, "Hello, doctor. Should I wait till 2 years to give this vaccination to my child, or should I give it at the age of 9 months itself? What would you suggest?"
Right. So everything is unpredictable. If you go by post-COVID session, as we all know that things are unpredictable as well. Earlier the better. Now 9 months, if you have an opportunity to get the vaccine done earlier, the better. Between that 9 months to 2 years of age, that interval period as well. What if the child catches infection? That could be dreadful as well. So ideally, I would suggest it's better to vaccinate as early as possible than to wait at the age of 2 years.
So, doctor, if you could please help us understand, bacterial meningitis is said to be dangerous for children. So, how can the meningococcal meningitis vaccination offer them protection?
So, bacterial meningitis, what tends to happen is these natural commensal organisms, because the meningitis can be bacterial, the meningitis can be fungal, the meningitis can be viral, and the meningitis can be in some terms of parasitic infections also as well. So these commensal organisms, which are in our respiratory tract, which are a common commensal sitting there as well. But sometimes when the immune system is bit low or anything, this tends to invade the bloodstream. When they invade the bloodstreams, what happens is they cause infection within the bloodstreams. Then the other organs of the body are affected, especially the kidneys as well. Then you can have brain. Now, these symptoms, they could have high fever, they could have headache, they could have neck stiffness, they could have fits as well. And because when they get infected with this meningococcal disease, where they can develop this blotchy, purplish spots and everything. And sometimes what tends to happen is they involve the blood vessels as well, and especially the tips and peripheries of the hands and legs. And some of these cases would need to be amputated as well. So it's quite dreadful because the severity is is quite directly proportional in terms of the multiplication of the organisms as well. They tend to get rapidly multiplying these organisms. At the same time, these kids could deteriorate completely. Even though they are being treated for meningitis, you could have at least 5 in 100 dying because of meningitis as well, which is quite serious. So this meningococcal vaccine, if you take it quite earlier, this tend to develop antibodies to fight against infection, even though they tend to invade. Even probably after taking the vaccine as well, which is not 100% guaranteed, you could still have symptoms or signs, but the severity will be far less than a child who's not been vaccinated at all. So it's worthwhile to take the vaccine when two injections could make a difference to the child's life and family. It's very important.
It's better to be safe than sorry.
Yes.
So we have another concerning question coming from Rosalind Khatua, who is asking, despite significant progress over the last few decades, meningitis remains a mysterious disease worldwide with a high death rate. So, what is the reason for an alarming death rate?
See, because most of the times the alarming death rate as well, it depends. One is the education with the general public, number one. Second, the accessibility, medical access as well, availability, accessibility as well. Now, if you take in terms from the West and here, now if you see all the diseases or the meningococcal diseases and the meningitis cases are being referred to the Central and Research Child CDC of that particular country, that so and so cases were traced. And whereas in our segment, we have a wide variation in terms of the private sector, then you have the government sector as well. And in addition to that, there's a lack of education as well. Now, most of the times, as I said earlier, it could be non-specific symptoms within the first 5 days or 6 days, where they can present with just simple fever, cough, cold as well, which could see a general practitioner. And it is very difficult to just pinpoint and say at that particular point. But always follow-ups are very essential. But later on, they could like day 6, day 7, day 8, they could have fever, they could have headaches, they could have neck rigidity, all this. But during that particular point, when they catch the infection, the severity tends to worsen at the same time as the organisms tends to multiply, because you could have a child who's very well by yesterday evening, by midnight they could deteriorate very rapidly as well. But having said that, it all depends the availability and accessibility of the medical as well. Because if you have somebody, yes, suspecting about this based on the signs and symptoms, they'll probably need IV antibiotics as an urgent phase to get rid of these organisms, because one injection at the earliest time would wipe out most of the bugs causing meningitis. So that's why it's called a mystery disease, because most of the times what happens is when they go to the general practitioner, and based on the clinical condition of the baby, you don't tend to do for every child who walks uh, in terms of blood tests or investigations or a lumbar puncture. You will probably do an assessment and then keep them for a follow-up as well. But still, again, because most of these cases are picked up later when they deteriorate, or they tend to present later with not seeking medical help in the earlier phase itself. That's why it's called a mystery disease. Or you could have child very well just 4 hours ago and then completely deteriorating the next 4 hours, which is of rapid intensity.
So, doctor, is there a good chance that a meningococcal meningitis vaccination will be effective for a child suffering from thyroiditis?
Uh, if you see, the literature has said like there is one condition called Hashimoto's thyroiditis as well, and in this condition of thyroiditis, there is proven that there is more of there are cells within a structure called lymphocytic that tends to cause meningitis as well, lymphocytic meningitis, and especially with these cases of Hashimoto's thyroiditis, there are more cases of this lymphocytic meningitis as well. Now, again, where they tend to present with fever, headache, and neurological issues and neurological damage in terms of long-term problems as well. But if the same child with Hashimoto's thyroiditis has had meningococcal vaccine, then the severity of this organism, severity of this meningitis would not be there, and it's definitely useful, especially in these cases of thyroiditis.
When it comes to a meningitis infection, what is the incubation period that needs to be followed in order to build immunity to the disease?
So the incubation period is like once the onset of symptoms to deterioration can vary anywhere between 3 days to 10 days. Now, as I had said, the first 6 days it could be completely non-specific symptoms. They're having mild fever or little bit of flu-like symptoms. But again, when the symptoms start, they did to deteriorate rapidly with fever, headache, seizures, rigidity, neck rigidity, or pain in the neck. They tend to deteriorate. So I would suggest the incubation can be anywhere between 3 days to 10 days. The moment you come across suspecting meningitis, it's worthwhile to start IV antibiotics to wipe out the organisms as well.
Tumpadas is asking, what is the ideal age for administering the brain fever and meningococcal meningitis vaccine to my child?
See, the brain fever vaccine is the usually it's called like the Japanese encephalitis. The brain fever vaccine can be vaccinated with 2 doses, anywhere from first year of life. You could wait till a period of 12 or 13 years of age. Again, that's in few segments or pockets. It's quite scattered uh, all over the country, and it's not prevalent in most of the cases. So before 13 years of age, that could be vaccinated, and but ideally the 2 doses, preferably after the first year of life. The meningitis vaccine, as I said, anywhere from 9 months to 13 months, 2 doses can be given, or if not, 1 dose at the age of 2 years. And co-administering them with the vaccine as well is not an issue, with no major side effects, and they could be vaccinated together as well.
Shravani is asking, can you please explain the benefits and importance of these vaccines in protecting my child's health?
Benefits like today, as we all said, uh, the today's children are tomorrow's citizens. See, the health is very, very an important aspect for the overall growth and well-being of the family. Now, these vaccines are derived mainly to develop antibodies to fight against these infections. And when these two injections could make a difference to the child's life, it's very, very, very important in the long run. Because, as I said, even if you're not vaccinated, you tend to get treated for meningitis at that particular time. There is high mortality, wherein 10 to around 5 out of 100 cases tend to die, even in spite of treatment as well, because it's quite detrimental and the severity of infection is quite high as well. So it's worthwhile to vaccinate the child especially at the right age group.
So, doctor, we spoke about meningococcal meningitis and also about the vaccine. So, could you please help us understand about what are the different forms of meningococcal meningitis?
There are different forms. One, we have something called a pneumococcal meningitis as well. Then then you have this H influenza meningitis, which is caused by, again, as then we have fungal meningitis as well. Then you have viral meningitis. Then you have something called parasitic meningitis. Now, these different, there is bacterial, there is viral, there is fungal, and then there is parasitic. Now, what would you do? How would you investigate? We don't tend to send in for every investigation. We need to wait, watch, do it after the clinical examination. We need to see the symptoms, the signs, and correlate with the initial blood parameters as well to see the severity of infection, and then take it from there. But obviously, the lumbar puncture is one of the gold standards as well, where you put in the needle between the two bone spaces and tap the fluid, and that is sent for a clinical examination for fluid analysis to prove about the meningitis. And this is where, its terms of bacterial meningitis, is very, very helpful. And even for the viral meningitis and for the fungal meningitis as well, there are different panels in terms of medical section where you need to ask them for all these extra tests based on this clinical picture as well.
So, doctor, for all the parents who have just joined us, could you please recap about the discussion we have had about brain fever and meningococcal meningitis vaccines?
Um, So, thank you all. So, just to read the recap of today's talk, what we had, we spoke about the meningococcal disease. As I said, this is very a dreadful disease where we tends to infect the meninges, the coverings of the brain, because we have the brain, the spinal cord, which is surrounded by a fluid called cerebral spinal fluid, and these organisms, where they naturally stay within our respiratory tract, the nose and commensals, they tend to invade, particularly, especially if the immune system is low, and where they tend to cause blood infection, severe septicemia, and they might infect the organs as well, especially the kidneys, and they tend to infect the blood vessels as well, and especially of the limbs, the hands and the legs, and which could be detrimental, where they could have uh, which could need amputation of these limbs. Now, the symptoms where they could present is they could present with fever, they could present with lethargy, they could present with headache and neck stiffness and drowsiness and altered sensorium in terms of altered consciousness as well. They could present with all these symptoms. The earlier the diagnosis, the better, and the treatment is initiated rapidly, even though you've not completed the investigations as well, because most of the times this tends to wipe out those organisms as well. Now, what do we do to prevent all this? So, vaccination is the final answer. So, vaccination is the key, where you need to tend to get them vaccinated around 2 doses within the 1 year of age group, or if not, 1 dose at the age of 2 years would be very beneficial to the child as well, because even though the child would acquire it, severity of the symptoms are very, very, very less in comparison to those who have not been vaccinated at all. So we spoke about the tests as well, which is involved, and we spoke about the long-term implications. What could be once a child is affected with meningitis? Where they could have a hearing impairment, they could have a neurological damage, where there could be weakness on one limb or particular limb, which could affect their day-to-day life activities as well. So this long-term neurological impairment is not just for a day or two; it could be for lifelong as well. So to prevent these long-term complications, to prevent meningitis itself, vaccination is the key, where they could get vaccinated with 2 doses within 1 year from 9 months onwards, or else if not, a single shot at the age of 2 years.
Thank you so much, Dr. Suresh Gowda, for
Yeah,
joining us and for this wonderful session.
yeah. Thank you, one and all. Thanks, Sanofi, for the